Are you? Welcome back. It is Tuesday night. Welcome for another Tuesday Transformers. Let's talk with Dr. Sabine Elisee. I'm your host. We're getting connected here now. When you come on in, go ahead and wave. Hi, Facebook. How are you? I want to check the sound, make sure everything is going well. Go on and give me a wave as you're coming in. I see some people signing on. Hi, Dr. Jada. How's it going? Glad that you guys could make it. And I'm trying to read these from afar. Queen Diddy. Hi, good to see you. All right, we're gonna get right in, and I can't see that name there. I'm sorry. When I get closer, I'll be able to see it. But good, I'm so glad you guys could join us today. Hi, Sunny Tassi, good to see you again. So we are back again for another episode of Let's Talk Tuesday with Dr. Sabine Elisee. I'm so glad that you guys could join us. Of course, I have to go through housekeeping, right? So when I'm looking here, it's because I'm talking to my Facebook folks, hi, not to ignore when I'm looking up here, when I'm talking to my Instagram folks, and I'm gonna do my best to make sure we are going ahead and engaging everyone. I wanna say hello. It is wet here in South Florida. I hope it's a little not as wet over there. So I do wanna say thank you, and hopefully we don't have any problems with any of your connection tonight. So I am Dr. Sabine Elisee. We're gonna get right into our topic today. I'm a board certified family medicine physician, CEO, and co-founder of Cornerstone Medical Group. I provide simple, concrete understanding to what's going on in your body so that you can identify two things. One, how it's affecting your overall well-being, and two, how it's affecting your daily productivity, right? And all of us wanna be more productive. How do I do that? I do that through my medical expertise, and I do that through my intentional focus on the entire body, where we're really focusing on the entire patient and how I approach patient care and reconnecting the physical, spiritual, mental components of your health. Welcome to another episode of Let's Talk Tuesday. Go on and wave to me when you come in. So glad to see you all. We had to do something for the fellas today. Tonight we are talking about what? Go ahead and put it into the comment line. Let's see who knows what we're talking about tonight. Let's see who can put it in there first. Let's see if it'll be Facebook or Instagram folks who are putting it in first. Let's see, I'm gonna give you a moment here. What are we talking about tonight, family? My Tuesday Transformers. We're doing something for the men, and I see it here. Yes, we're talking about prostate health today. We are talking about prostate health specifically. The screening we're going to talk about today. We're going to speak about a little bit of what and who is at risk. Obviously men, of course, because we're talking about prostate, we're talking about men. But more importantly, based on ethnicity, family history, and age. These are the three things: age, ethnicity, as well as family history. These are the three things that play a role in that screening and if you're at risk. And then we also want to kind of debunk. We want to get rid of some of these myths of what happens, what occurs, and what should occur, and quickly talk about some of the new guidelines as well too on how to have that simple screening. So let's get right into our topic. Once again, we're talking about prostate health. Share this, of course, with someone. Let them know if you have a man in your life who refuses to go to the physician and get some of these things checked out. Make sure that they know about this video at least, so that they can at least get their information and know what's going on. So what are we talking about? Prostate health, prostate health. And of course, when we think prostate health, we immediately, our minds immediately goes to what? Prostate cancer, all right? So that's where the screening comes in. I want you to put in the comment line, PSA, PSA. PSA. This is the number that we look at as a family medicine physician. It's the number we screen for starting at the age of 55 if you're not at high risk, starting about 40, 45 if you are at a higher risk. I put PSA in the chat. That's the test that is taken, and we look at that PSA and it tells us everything that we need to know about the prostate. It tells us everything we need to know about the prostate. So I want you to remember that, especially my fellas. I want you to put that in that chat, because that's the number, or that's the thing that you should be asking your physician about, right, when you're talking about your prostate. And I'm going to give you specific numbers tonight so that you could understand and know why that is important. But before we talk about any of that, let's speak about prostate cancer and who's at risk. So and you saw that in the chat, and as well as the post that I put in earlier, that prostate cancer is actually the number 2, the second most common cancer among men. Number 2, go ahead and put number 2, hit a number 2 in the chat. Prostate cancer is the second most common cancer among men in the United States, all right? That's number 2. So there's definitely reason that we should be speaking about this. And a lot of times when it comes to cancers, there's not all of the cancers that we could screen for, but the ones that we can screen for, the ones that we could prevent, those are the ones that myself as a family physician, I want to pay attention to, and I want to make sure that we're talking about more of. So what are your risk factors for having prostate cancer? What are the risk factors? Number 1, age. Age. I want you to drop age in the comment line. Write the word age, 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 age. It's actually the older you get, the higher risk that you are of getting prostate cancer. So age, put age in the comment line. The older you get, the higher risk that you have of getting prostate cancer, specifically over the age of 65. So the older you get, the higher risk you have of getting prostate cancer. And with that, there's some studies that say if you live long enough as a man, you'll actually get prostate cancer. But the good news is that many prostate cancers are slow growing. They're very slow growing, and they don't affect many patients. So what does that mean? There are many men after the age of 65, into their 70s, they get prostate cancer, but it doesn't affect them. So there's no need to do any treatment because that's not going to be the thing that kills them. What we want to talk more about are for those individuals who are younger in age and have that risk. So if you are younger than that higher age, you still want to get screening. The literature lets us know that for some reason, Black men have 2 times higher risk than white men of getting prostate cancer. I don't know why, why it doesn't specify. And likewise, white men have a 2 times higher risk of obtaining prostate cancer than Asian or Hispanic men. And again, we don't understand why, but this is the numbers that come in. Because my background also I have in public health, a lot of that we would say, well, maybe it comes down to screening, maybe it comes down to how often people are actually going to the doctor, any one of those things. We don't really know the specifics of that, but the more important thing that we need to know, yes, if you are a Black man, you are at higher risk, twice higher risk of getting prostate cancer, 2 times higher than white men. If you are a white man, you are 2 times higher risk of getting prostate cancer than Asian or Hispanic men, which really means that Hispanic and Asian men have a very low risk of getting prostate cancer. And those that are higher risk are Black men. And for that reason, the screening for our Black men should be a little bit earlier, before the age of 55. The other thing is a family history. Family history is another increased risk of getting prostate cancer. Family history. So if you have a first-degree relative, this is what we call a first-degree relative, individuals who are your parents, siblings, or children. Parents, sibling, or children, your first-degree relatives. If you have a first-degree relative who obtained a brother who had prostate cancer before the age of 65, if you had a brother before the age of 65 who obtained prostate cancer, then you have a higher risk as well too. And then also, if you have a sister who had breast cancer, a sister with breast cancer also puts you at a higher risk. All right, so we talked about the risk. We spoke about age, we spoke about ethnicity. Our Black men, higher risk, have a higher risk than our white men, and our white men have a higher risk than our Asians and Hispanic male. And then also we spoke about primary degree, or first degree, relatives, and that's anyone who has a brother who had prostate cancer before the age of 64, you have a higher risk. So you should be getting your screenings a little bit earlier. 45. 45. I want you to put that number in the chat. 45, if you're at a higher risk, then that's when you should get that screening. Age 45. Normally, if it's after, if you do not have a higher risk, then the normal age usually is about 55. So 55, you get that test. And what test are you getting? You're getting the PSA. You're looking for the PSA test to see where that number is and where it should lie. Now, your PSA test should be between the numbers 1 and 4. PSA test should be between the numbers 1 and 4. And that's what we're looking at it. We follow it each and every year. As long as that number is below 4, then you're pretty good. You're good to go. Shouldn't have a problem. But because we're following it every year, there's a necessity to pay attention to something called PSA velocity. PSA velocity. So the question also comes up a lot of times is, what exactly is the PSA test? The PSA test is a blood test, I have some patients that come in and I mention to them, it's time for us to do your prostate exam. And of course, they think that I'm going to actually do a manual exam. But we don't have to do those manual exams anymore when we're doing that first screening. And we're going to speak about that in a moment. Why? We don't have to do the manual exam. That's right. We do the prostate exam to begin with just a simple blood test where we check the PSA and we make sure that number is below 4. It is very important for us to follow that number every single year so that it can remain below 4. The only time I would jump as your physician if I see that number jumps too quickly. So let's say this year I check that PSA in my male patient and it's at 1. Perfect, great. And then next year, I check that PSA and it jumped to 4. This is called the PSA velocity. It jumped too quickly in a short amount of time. And this would make me scratch my head and retest again before we go to the biopsy. I would retest it again, retest that PSA number again. For those of you who are going to get a PSA done, it's very important, some things that you need to remember the day before. So there's some literature that has come out that let us know that, and that's part of the reason why as primary care physicians and when you have your first screening for your prostate exam, we really do not recommend doing that digital rectal exam anymore because any manipulation to the prostate can increase that PSA number. Any manipulation to the prostate could increase that PSA number. What does that mean? If you had sexual intercourse the night before or in the last 24 hours and then the following day you get that PSA done, that could increase the number. If you had a digital rectal exam before we took the blood draw, that could increase the PSA number. If you're a cyclist and you are riding and you're cycling, again, that's manipulation to the prostate. That again can increase that PSA number. And that's all part of the reasons why we do the blood test to begin with, and then we recheck it. If that number is higher than what it should be, then we recheck it. So those are the big points of the PSA test, the prostate test. There's a question that some people will often ask too, and this is something that's outside of prostate cancer itself, where we see an elevated PSA. So really it's a question of why do we see elevated PSAs? We spoke about if there was any manipulation to the prostate the night before, you could see an elevated PSA. And the other reason why you could see an elevated PSA is something called the BPH. BPH. Go ahead and put that in the comment line. BPH. I'm trying to add it here on Facebook. I'm not sure if it went through, but someone over in Instagram, if you could put it in the comment line, BPH. This is benign prostatic hyperplasia, right? So benign, that means that it's not cancer at all. And it also just means that the prostate is having a more massy type of tissue. That could also increase the PSA number, and that has absolutely nothing to do with prostate cancer. So if you or your loved one has that PSA number that is elevated, that's on the upper levels of 4 or even higher than 4, that doesn't mean you immediately go through that full next step of getting the biopsy done and going through all those procedures. What you do is recheck it. you recheck it. And you recheck it and you follow the numbers from the year before. This is why it's so important for people to see their primary care physicians. I say this to my patient a lot of time. What we want to do is always get a baseline, and we follow that baseline. For my patients who are healthy, I don't necessarily need to be seeing them every 3 months, but I do like to see them at the beginning of the year, and towards the end of the year, at least every 6 months, so that I could have an idea of what's going on with them and just kind of get a baseline. That it's especially true for our men, particularly when it comes to the PSA, because you have some patients who could have very well have a high PSA number, that's their baseline, and we won't know that. But when they come in and we don't have a baseline and we see that number very high, everyone gets scared. They may go through different exams and follow-up exams that may not be necessary, and that's what we want to avoid. So those are our big points about when we're talking about prostate health, getting that screening done. Again, those of you who are high risk, for some reason, it's our Black men at higher risk than our white men, who are at higher risk than our Asian and Hispanic men. If you have a first-degree relative, a sister who has breast cancer, a brother who had prostate cancer before the age of 64, that puts you at higher risk, and you should be getting that screening done at about the age of 45. Otherwise, 55 is the age, and you stop that screening at 69. 69 is when you don't need to get that screening anymore, because like we said, as you get older, you have increased risk, of course, of getting prostate cancer. And we also see as patients get older, that PSA number actually goes higher a little bit too. So that's our biggest points here. I'm trying to think of if there's anything else that I really want to speak to you about and really make sure that we highlight, but I do want to give some time to answer any questions for any of our Tuesday Transformers who are on. And then as you start typing any questions you have, I do want to say hi to Erica Goodwin. Thanks for joining us. Seni Tassi, always great to see you. Edwidge, Jean-Claude, hi. Vic for real, Tanya Deli. I'm going to reach over here on Instagram and wave, and also come down to say hi to Dr. Monica Peeds. Thank you for joining us. So glad to see you. Savage, 330. Nice seeing you. Hope you guys are learning. I see some people dropping some notes in of the PSA, and I see somebody else here, 5923. It's so difficult to read this upside down, but I do want to say thank you for joining us. And I do want to answer any questions that you may have before we sign off. Hi, Dr. Jaquel. Nice to see you. Thanks for joining us. And let's see, who is this? I'm going to get this. I have Holt Virtual Assistant. Hey, thank you for joining us, Holt Virtual Assistant. Glad you could join us. So that's our talk today on prostate health. Biggest thing, take home points. Get the screening. You don't have to cough and turn your head anymore for that simple screening. It's a simple blood test. But before you get that blood test, make sure within 24 hours or 24 hours prior to that blood test that you minimize or eliminate any manipulation to the prostate, which means don't have any sexual intercourse the night before. Make sure you're not cycling on a bike, and just eliminate any manipulation to the prostate, because that number is going to be higher and it's going to be incorrect. All right. So I'm so glad you guys could join us tonight. Again, if you have any comments or if there's a topic that you would like to hear more about, please go ahead and send me that message via Facebook or on Instagram at Dr. Sabine Elisee, DrSabine Elisee. It's always good seeing you. If you find that this information that we shared tonight could be helpful to someone else, don't forget to go ahead and share, because sharing is caring. And what we want to do is educate as much as we can. You guys have a great Tuesday night. Good seeing you again, and take care. And we'll see each other next week. I want to say hello again to all of you, the Tuesday Transformers who are on here, taking care of your health, learning these small steps to make you healthy so that you could be empowered to have greater discussions and understandings with your physician. All right, guys, have a great night. Good seeing you. Bye.